Life is full of milestones, from turning 21 to hitting 50. These exciting moments often bring about big changes, but growing old can come with a new set of challenges many never expect. These bumps in the road can be a deadly issue for elderly men. According to the CDC, men in their 70s and 80s have always been a group that's at a higher risk for suicide.
When you have risk factors and you're suicidal and you're older and a male, you're more likely to actually complete it. So, you really have to look for it closely.
That's Dr. Carrie Ditzel, a clinical psychologist with Baker Street Behavioral Health. She says the suicidal tendencies aren't specifically connected to any certain age.
It's not just suddenly when someone gets older or a male that they're more at risk for being suicidal. It's more that this particular group of individuals, when they are suicidal, they're more likely to complete suicide or be successful. They are more lethal in their attempts versus maybe younger cohorts that might have more attempts that are what people might in lay say are cry for help. Whereas when an older person, an older male, has these risk factors and feels suicidal, the risk of them actually committing suicide is higher. They're more lethal in their attempts.
While experts know that older men are at higher risk, there's no one reason for why this is. Each case is different, and there are several variables leading to higher suicide rates. One being that older people tend to have more health problems and have a harder time getting around on their own, which can lead to social isolation. Other factors could be related to dealing with complicated grief or feeling lost in this stage of their lives.
When you think about their life course, right, has very likely been a provider, been very much purposeful in their life. And then after retirement, as they get older and older, maybe that purpose is more difficult to grasp, right? So they feel a lack of purpose. So that's a factor. Having physical illnesses that impact their functioning is a risk factor as well. And just the report of pain, of psychological pain, physical pain, those are all risk factors for this group.
And though these risk factors aren't exclusive to men, women in this age demographic don't seem to be affected the same way. In fact, men have a higher rate of suicide across the globe, according to a 2015 paper in the Indian Journal of Psychiatry. So why do these factors, experienced by both genders, seem to have more deadly outcomes for men?
My guess would be, if you think about it from kind of a psychological standpoint, the purposefulness is a big part of maybe the male identity, taking care of taking care of oneself, and not being able to do that, or maybe losing a spouse and not being that partner anymore and having that purpose maybe has a bigger hurt or psychological impact compared to a woman. However, that's really just subjective.
So as millions of baby boomers head into retirement, Ditzel says it's important to make a plan for your future. Know what makes you happy and what gives you a feeling of purpose so that you can carry that into this next phase of life.
If you are a workaholic in your 40s, 50s, and 60s, you better have a plan for feeling some purpose and sense of need to get up in the morning if you're not going to be working forever, or will you work forever, right? So I think knowing yourself and acknowledging that there will need to be some active changes or plans that need to be made as you get older and as you change your pace of life, which is a good thing. It's a good thing maybe to slow down or not have the same kinds of responsibilities.
Ditzel says we should pay more attention to our loved ones who are experiencing some of these life transitions. And though topics like depression can be difficult to bring up, she encourages people to have an open conversation.
A lot of people in this cohort, that the statistics will say that they saw their primary care doctor, within a month or two before suicide versus a mental health provider. So realizing that the people that they're talking to, their medical doctors or other care providers, might be the first people to see these signs and symptoms. So if you are caring for a loved one or involved in older adults' care, making sure you're talking to them, asking if they're screening for those things, if they're seeing signs or symptoms as well of suicidality in particular.
And if someone is having suicidal thoughts, Ditzel says getting them immediate help can save their life.
You want to take them immediately to an emergency room or get them in front of a healthcare provider immediately. That's number one. If somebody's telling you maybe that they're just depressed or just not feeling right, then looking towards maybe finding a mental health provider or even taking them to their medical doctor if you can get there easily and quickly, go there first, kind of a thing. If they're at real risk and they're really telling you and you really don't feel good about the situation, nor do they, it's an immediate response that you have to have.
Even if an older adult doesn't have thoughts of self-harm but is experiencing depression or anxiety, finding them reliable treatment is key. Ditzel says adding in talk therapy can allow people to work through their problems in a constructive way. The help of a professional can also provide structure in creating a plan to get back on track. And if you see a loved one struggling or regressing backwards, don't be nervous to ask them directly if they're having suicidal thoughts.
A lot of people feel sometimes hesitant or scared to talk about it. They feel like they're going to put the idea in someone's head, and that's not the case. If somebody is struggling and thinking about death or dying or wanting to commit suicide, you're not going to give them that idea. So that's really important for caregivers to remember. If you feel like something's not right, asking about it pretty directly is a good thing to do.
Ditzel hopes that as men feel more comfortable talking about their own emotions, the late-in-life suicide rate will begin to go down. If you or someone you know is having suicidal thoughts, the National Suicide Prevention Lifeline offers 24-hour support by calling 800-273-8255. To find more information about Dr. Carrie Ditzel, visit radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer this week is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
It's been 2.5 years, and I still, several times a day, just have smaller waves of shock roll over me now, where I'm just like, I can't believe he's gone.
How to support someone after a traumatic loss.
Then how Botox can help your overactive bladder.
If people fail medications or can't tolerate side effects, which common ones are dry mouth and constipation, then you move on to third-line treatments, including Botox.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If you're going to innovate, if you're going to build the future, it's not enough just to have a fancy pedigree or a really nice resume. You've got to be clear what value you can add as a professional.
How to jump jobs in an economy that still favors workers. Then,
I believe that every region and every community across the planet should be able to feed themselves.
The struggle to keep America's farmland in the hands of farmers. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.